Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Vivian Williams, in for Tracy McRae.
Well, Vivian Williams, TV personality. Nice to have you with us. And thanks for sitting in for Tracy.
My pleasure.
So today we're going to talk about Peyronie's disease. And I think the correct pronunciation is actually Peyronie's disease. I think he was a French surgeon, in case you're interested, way back in the 1700s. Well, Peyronie's disease is the development of fibrous scar tissue inside the penis that causes curved, painful erections. Now, having a curved erection isn't necessarily a cause for concern, but Peyronie's disease can cause a significant bend or significant pain in some men.
And that can prevent you from having sex or might make it difficult to get or maintain an erection. And if you have it, Peyronie's disease can be a source of stress and anxiety. And here to discuss the problem, including treatment options, is Mayo Clinic urologist Dr. Matthew Ziegelmann. Thanks for joining us.
Thank you so much for having me. What a pleasure.
Dr. Ziegelmann, nice to have you here, and a difficult subject, to say the least. And I think you have just finished a male fertility and sexual dysfunction fellowship, correct?
That's correct.
And where'd you do that?
I did that at Rush University in Chicago, Illinois. I worked under someone named Lawrence Levine, who is Peyronie's guru, so to speak. And that was a main focus of my training, was to learn more about the medical management and surgical management of Peyronie's disease.
Peyronie's. So yeah, we've always
yeah.
pronounced it wrong, Peyronie's, but it's Peyronie's. So I've been seeing I watch a lot of Golf Channel, and I got to tell you, I've been seeing a lot of ads for Peyronie's disease, and it sends you to a website, and I believe it's learnaboutpd.com, and I went there because I wanted to try to learn something before we interviewed you, and it was for a medication. Correct?
Correct.
And why now? Is it because this is a new medication?
So really what's put Peyronie's on the map as far as bringing it to the forefront is this medication known as Xiaflex. It's a collagenase that was FDA approved in 2013. And because there's an interest from industry and getting the information out to consumers about this medication, it's come to the forefront, and I think that's great. It brings a lot of men in the door. This isn't the right treatment for everyone, but at least it lets men know, hey, this is a condition that's common, and there's things that we can do about this. You just need to go to your healthcare provider to learn more.
So abnormal curvature of the penis, how many men are affected by this disease?
So it's actually a lot more common than you would imagine, and I think a lot of this has to do with that men aren't always talking about it. But the studies that look at prevalence suggest that up to anywhere from 3 to 9% of men have symptoms of Peyronie's. Now, it's probably more on the order of 1 to 3% of men who actually go in to get evaluated for Peyronie's disease. There are certain risk factors that we think of that may increase your risk of developing this type of condition, specifically a history of prostatectomy, diabetes.
So if you've had your
dysfunction.
prostate out, you're at risk for this?
There is a higher incidence of, or a higher prevalence of Peyronie's disease in men who've had a history of radical prostatectomy for prostate cancer.
Okay. And what other risk factors?
So essentially, other than prostate cancer, we know diabetic men seem to be at an increased risk. Men with erectile dysfunction seem to be at an increased risk. There's a condition known as Dupuytren's contracture, which is quite common, and a lot of men seek consultation for this because it in fact impacts their ability to use their hands as effectively.
Explain what that is.
Yeah.
That is scar tissue that develops in the I believe it's the flexor tendons
That's
of the
exactly
hand.
right. Yeah,
Okay.
that's pretty good for a urologist.
Yeah.
So it's the same
The
sort
whole
of thing in the penis.
Correct.
Scar tissue.
Yep. So this is a condition. Basically, I describe this to patients as a wound healing disorder isolated to the penis. Men, we all probably sustain some extra pressures on the penis, oftentimes during sexual activity, but it can be trauma from other causes, accidents, things of that nature. But in most men, their body responds to that trauma and heals the tissue normally. And men who we think have a genetic predisposition to develop exuberant scar tissue, their body forms a scar and then doesn't remodel the scar. And the same thing we presume happens in the setting of Dupuytren's contracture as well.
So if you've had trauma to your penis when you were younger, can it potentially develop later, even though the trauma was ancient?
Potentially. Only about 1 of 5 men that we see in the clinic recalls a specific traumatic event to the groin or to the penis. Most men don't, but we think it's probably more in something such as micro trauma. So essentially extra pressures that may not register as true trauma to the penis, but result in some injury.
Does this come on? Sorry.
No. How does the medication work? So if you're having a scar tissue, how would medication? Does it stop the scar tissue from forming over time, or how does it work?
So they've done a lot of research. Ideally there's going to be even more research going into this, but a lot of research understanding fibrosis, understanding wound healing
meaning
disorders.
scar. Yeah.
Scar, correct. And the medications that we've historically used, a lot of them being oral medications and now more recently injections, they've all been medications that mechanistically alter the scar tissue. They remodel the scar tissue. They try to induce the body to change that scar tissue into a more normal type of tissue. The most recent medication on the market, this collagenase or Xiaflex, which came about in 2013, actually it's an enzymatic medication that breaks down collagen, which is one of the most common components of scar in Peyronie's, with the hopes that your body then brings in more quote-unquote normal tissue to fill in the gaps where this medication has worked.
So you've got oral medications that historically have not been that effective.
Correct.
You've got injections, and is this one injection or multiple?
So if we're talking about, any of the injections, they've looked at a variety of agents. The ones that have really stood the test of time are three. There's something called interferon. There's a medication called verapamil, and then most recently this collagenase Xiaflex.
Is this the best? Does it work?
I think that's a little bit of a loaded question. Depends who you ask.
Well, there's a gentleman in our audience who wants to know. I'm sure more than one. Yeah.
I think that it is an excellent option for the appropriately selected patient.
How many injections did you say?
So if it's collagenase, it's a marathon. So these men come in usually for an injection, a day or two later a second injection. Then we have them wait 6 weeks, and we do it all again. And the standard protocol that was used for the FDA trials is a total of 8 injections over 4 cycles, essentially.
All right. Now
I would imagine that would scare people to not go in to get help. But, if the injections, they do it in a way that's not too horrible.
Yeah, most men tolerate these types of treatments very well.
Good.
There are side effects with any of the treatments we offer, but most men tolerate this very well. And surgery is an excellent option for Peyronie's, but there's a lot of men who either aren't at a point where surgery is indicated quite yet, and that gets into a little bit of the nuance of how we treat this. But also there's a lot of men who desire a treatment other than surgery. And it's wonderful that we have tools in our armamentarium that allow us to do this to
all
help
right.
men.
Yeah. And tell us about the one that I know you are particularly interested in, and that's traction.
Yes. So penile traction, actually, I believe this was originally studied in the setting of Dupuytren's contractures as well.
That's the scarring of the hand, palm of the hand.
Correct. So essentially what this is applying a mechanical force to the scar tissue, which induces at a cellular level changes that remodel that scar tissue. It's a process known as mechanotransduction. It's been studied in Peyronie's disease and other fibrosis disease processes. And essentially this device these various devices allow you to apply traction forces in a sustained manner to the scar tissue in Peyronie's disease, scar tissue on the penis, that have been shown to improve curvature, penile length, which is a big concern for a lot of men with Peyronie's, and possibly even some enhancement of girth or loss of the girth within the penile shaft.
It's like
and how often?
Almost,
oh yeah.
Right?
That is a way that we sometimes use to describe the fact that, once again, this is more of a marathon type treatment. We're not expecting overnight results with this type of approach. But yeah, we're a sustained pressure that causes changes in the tissues that ideally you're going to see a prolonged benefit as a result of.
Every day? How many hours?
Yep. So it depends on the type of device and what study you looked at. Historically, until very recently, all of the studies that showed benefit for men with respect to either curvature or length recovery suggested you needed to wear these devices often 3 to even 9 hours most days of the week for a period of up to 6 months to see benefits. Now, recently, there was a device that was invented or created called the Restorex device. It was actually created here at Mayo Clinic by one of my former colleagues in conjunction with some of our engineering colleagues. And basically, we saw that there was an opportunity to improve on the devices that were out there. Now, this device, we recently performed a randomized controlled trial where we randomized men to use traction for 30 to 90 minutes per day versus a control group that we just followed with no traction. And using the device for 30 to 90 minutes, we saw significant improvements in curvature and penile length. So still having to wear a mechanical device for up to an hour and a half a day, but significantly less time and a higher compliance rate if you compare that to men who needed to wear these devices for 3 to 9 hours per day.
And could you wear this in public? I mean,
it's amazing what lengths patients will go to use this device if they're really motivated. So I've certainly heard of patients modifying their clothes, etc., to be able to wear this in
but
public.
normally
we encourage them either in the morning or at night. Yeah.
And it seems like a great option for people who don't want to have injections or take medication because it's, even though it's a brace, it's non-invasive.
Correct. And we often use this in conjunction with our other therapies, whether it's the intralesional therapy, so the injections of medications, whether it's in the recovery period after surgery, or leading up to those interventions to try to optimize outcomes. So it's an excellent treatment option.
Peyronie's disease, first described more than 250 years ago. It's an abnormal curvature of the penis. It can cause pain, erectile dysfunction, shortening, and difficulty having sexual intercourse. It's always been difficult to treat, but there are options: medications, injections, surgery, and a new modality, not necessarily new, but fairly effective modality that we just heard about, penile traction.
Yes, and our thanks to Mayo Clinic urologist Dr. Matthew Ziegelmann, and we're going to take a short break. Thanks for being here.